Hi everybody, my name's Deb and I'm coming to you today for the girls show. We are via Zoom, and of course you can see I have my daughter Janine and my daughter-in-law Lori coming to you from their homes as well. We are really excited about today's show because we have a special guest on that's been with us many times. But before we get to Dr. James Deom, we're going to talk about something today. Janine and Lori, I think you're going to be very interested in, as long as a lot of our guests are also. We both have pets. Janine, you have a dog. Lori, you have 2 dogs. And of course, everybody knows I have my little Gucci here. And my dog had a flea, a tick, I should say, not a flea. He had a tick. So I got concerned about that. I'd asked my veterinarian about, what to use, being that he couldn't use the creams on his back. He was allergic and whatever. So she recommended the Seresto flea and tick collar. Now, this is not for or against anybody's collars. I'm not promoting anything. I'm not saying anything against them. Always check with your veterinarian on it. But I read an article and I saw something on YouTube about how there are fake Seresto collars. So I started getting like a little concerned. Of course, our pets are our babies, right, girls?
Absolutely.
Yeah. So I started doing investigating, and I just want to make sure that no one out there ever gets scammed into this. Sometimes you buy a Seresto collar and they're $58. It's a lot of money, but they last for 8 months. So then every once in a while, you'll see the little advertisements come across maybe your Facebook, or you get an email about Seresto collars, where to order them, and they're discounted. And I ordered a flea and tick collar. And when it came in, I started doing the checks on it. And the way that you could tell if you have a real collar or not is, number one, when you look at the can, the name should be straight. And even if you look at the side of it, it'll show you the name Seresto again. And again, that should be straight. Some of the fake collars, you'll see where the lettering is wavy. They also have a picture of the bear flea and tick collar on the outside of the tin. And the fake ones are really wide and they don't show the little indentation. The real ones have a thinner. Then you go into the inside. In the inside, when you open it up, it's sealed. And you could see through this package. I didn't know to open it up at all. And Gucci's agreeing with me there. But on the collar itself is a serial number. The serial number on the collar should match the serial number on the back of the tin. The front of the tin also should be printed right in the tin. It shouldn't be a label. The back of the tin is a label, but you'll see several batch numbers in tin and different numbers, but that number should match the number on your collar. To go one step further even than that is the real collar. You see how it's like powdery, light powdery? The fake collar, this is a fake, by the way. The fake collar is like dark gray, and it's very thick, rubbery, and it smells like rubber. The real collar, there's no odor to it at all, and it's real pliable. The other is just really stiff. So if it looks too good to be true, the price, this one was $27.99, and it's a fake.
I always get my medication and all of the things that I do for Rosie right from the vet, but she can't have, I don't know how some people are. I know my friends who have small dogs, and Laura, you probably agree with me. Like my dog she had a very severe allergic reaction to even the rabies shot. Her face swelled up. I had to rush her to the ER. So I don't even give her some of those things. Laura, do you with your dogs?
We do not, Janine, because we had a similar issue. A veterinarian almost killed our dog. So unfortunately, he had a reaction when he was a year old, and they had nothing to counteract the reaction. So since then, our veterinarian, is very particular about what we do give our dogs. Now we have a 19-year-old dog, so he really doesn't require too much because of his lifespan. We don't want to shorten it from some stuff because it could hurt him. But for flea and ticks, I've read online and have checked with our veterinarian. I do tea tree oil just on the leash, not on the dog or on the collar, because tea tree oil could be poisonous to dogs. So that's what we use. I do not give my dogs any flea or tick medication.
Let's lighten the mood a little bit, ladies. We have to go to a break. It says happy birthday, but I actually just got glasses, and we're going to talk about our eyes. And Lori, you know all about the importance of getting our eye exams. Even if you have 20/20 vision, you should still get the back of your eyeballs checked. And our guest is a very good friend of ours, and he also has a TV show here on SSP TV, Dr. James Deom. He is with us, and they have several locations throughout our viewing area. He's going to be with us when we come right back, so stay with us.
Welcome back to The Girls Show. We have a special guest with us today, Dr. James Deom from Hazleton Eye Specialists, Stroudsburg Eye Specialists, and now located in Pottsville at the Pottsville Eye Specialists. Welcome back to the show, Dr. Deom.
Hey, what is up? So happy to be here. Thank you for having me.
Thanks.
Well, I can see you a little better now because I have my new glasses on that we're going to talk about, right? I told everyone before the break we were going to talk about why you should get your eyes checked even if you have 20/20 vision.
That's right. Yes. Very important to get your eyes checked. Why? Because it keeps me in business. No, I'm just kidding. No, the reason why is because, of course, there are literally hundreds of diseases that you can find or manage and monitor by just looking inside the eyes. Things like diabetes, high blood pressure, heart problems, and many, many more.
Okay. So I gave in. I came to you recently because I am straining my eyes to see this computer that I'm on 24/7. And what can you talk about? I know we were going to show the back of the eye and talk a little bit about that. I know my mom and Lori know a lot more about, this because I failed to go to the eye doctor until I needed to.
You're one of the worst kind of patients.
Thank you very much.
I think, here we are all sitting on Zoom. Right.
Yeah.
And you're looking at me, you're listening to me, but you're also looking at yourself. Right. And we're all kind of more aware of what we look like and everything else. And so one of the things that I think, it can happen, as I'm talking to you all today about vision, of course, but certainly, I think on your show, you talk a lot about appearance and, beauty and comfort and all these kinds of things. And so certainly if you're not seeing well, you're going to be squinting, you're going to be, eyebrows and things are going to be, creating some stress on yourself. And so, certainly to relax your face, to relax your appearance, to provide a more comfortable look and appearance, be able to see clearly is very important. Obviously. And so, I think in this, again, Zoom world that we're in, we're all paying attention more to how we look. We're looking at others, but we're also staring. When do you ever have a conversation with somebody where you're staring at yourself the whole time? Well, that's what the Zoom world is. And
every day now, every day, all day long.
Yeah. You're talking to people, but you're staring at yourself. Right. And so it's kind of a different thing, but yes. So, this is something we all run into, is this difficulty with seeing in particular up close. And it happens typically in our mid to early 40s. And so this is an eyeball. All right. Inside the eyeball is a muscle. All right. And that muscle is called the ciliary body. And it literally flexes when something is near to us, when we look up close. And so that flexing of that muscle contracts a lens inside the eye, and it allows us to see up close. And I'll use an analogy of a camera, something you guys are all very familiar with, right? A camera lens will change and focus variably at different distances. So if you have your iPhone, you're focusing at something, you'd see it go blurry and clear. You're focusing on something. Our eye does that. And so, in our mid 40s, we actually have a loss of the elasticity of the lens inside our eye and a change in the muscle's ability to flex. And so we have a difficult time seeing up close. So what do? We push things further away, which obviously makes it harder to see things, or we do this. And that's not a good look for anybody, right?
So you're telling me if I wear glasses, guys, if anyone gets glasses, you will never get wrinkles. That's what he's telling us.
This is what I didn't say it, but you put the dots together. So I appreciate it.
There you go. So I'm going to walk around with these. You won't see any wrinkles.
I was waiting for you to tell me, what are you saying? I have wrinkles? No, that's not what I'm saying.
And you said I was in my mid 40s. On the show, I'm only like 30, 35. So
that's right. That's true.
Get your back straight. Can you talk a little bit, Doc, about the back of the eye when you said like sometimes you could or you can see like, it looks like a little freckle, or like, what were you telling me in the office during the exam? Can you explain that?
Yeah. So very common that we see accumulations of pigment in the eye. Okay. So the eye, I'll often tell people the eye is really the outside of the eye, and the inside of the eye is kind of like an extension of our skin, and it's specialized skin. And so just like the skin on your body, you can have pigment on the skin. You know, I'll often point out little freckles to patients and say, you see, I have little freckles here. If one of these was to get big and different colored and elevated and maybe some wild hairs on it, you'd be like, what's going on? You know, you would absolutely ask a doctor, you know, what's going on with this freckle on my skin? Well, unfortunately, when it comes to the specialized skin that is our eye, we don't have the ability to see what's going on in there, right? You can't know if something's growing in there per se. And so most people don't know, but it's not that uncommon to have a freckle inside your eye. And so we want to make sure that that is not changing, much like the freckles that you would find on your skin, because there is a risk of melanoma inside your eye. And you know, while it sounds like extremely rare, I've in my career seen at least 2 patients that have had a confirmed melanoma. One needed to have their eye removed to save their life, because melanoma is something that can, go to other parts of our body and become malignant. And the other had something called plaque therapy, where they actually had a little plaque sewed into the back of their eye, the retina, where radiation was placed on that particular area, so it didn't spread to other parts of their body. So while it is rare, it is not uncommon. While it is uncommon, it is not rare. That's what I meant to say. So it's not rare when it's in your chair, is what they taught us in school. So it's true. Anyway, so yeah, there you go.
Dr. Deom, I know just, being associated with the Blind Association, of course, we have so many people who have said to me, I saw perfectly fine yesterday, then I couldn't see a thing. And so, that reason, when I'm out talking about eye health, I always tell people it's important to go to the eye doctor, because glaucoma, you don't know sometimes,
Right.
if you have glaucoma. I know in the Blind Association world, we call it the sneak thief of sight, because
Right.
it could just take your sight away.
Right.
So can you talk a little bit even about glaucoma? Because a lot of people don't know a whole lot about it.
Yeah, I'd say the 2 big sneaky ones. We probably don't always classify macular degeneration as a sneaky one, but it is. But so both of them, glaucoma and macular degeneration, both silent thieves of sight for sure, because you don't feel it. There's no pain. Most eye conditions are totally painless, which, again, sneaky, right? You think of things that bother you, that cause you discomfort and pain. Glaucoma, no pain, totally painless. And what happens is, unfortunately, it slowly takes our side vision away. And you may have no clue this is happening. Why? Because our brain is extremely flexible and really just kind of adapts really quickly. So if there's small changes to our side vision, you will probably not ever know about it. And so this is one of those things. Again, Janine, you're asking about looking at the back of the eye. We can very easily see if somebody has risk for glaucoma just by looking at the back of their eye, in particular their optic nerve, which is basically what I always tell people. It's like the electric cord of the eye. It plugs in the back of the eye all the way to the part of the brain responsible for vision. So definitely sneaky one. The other one is macular degeneration. I think macular degeneration is very pertinent probably to your listeners. Why? Because more often affects women than men, significantly so, actually, more 70 to 30%, 70 female, 30 men. And it is, for most people, there's 2 different types, dry and wet. And the dry form is in many cases asymptomatic. So most of the people that have dry have no clue that they have it. And it's when you have dry macular degeneration that we can often affect change. In other words, we can reduce the likelihood that you develop wet macular degeneration, which is where there's more devastating amounts of vision loss. So things as simple as having a good diet, and fish, and eating dark green leafy vegetables, avoiding smoking, and protecting your eyes from the sun.
Lots of good information. We come back. We want to know why people who are blind should also see the eye doctor. We are with Dr. James Deom of Hazleton Eye Specialists with several locations. We'll be right back. You're watching the girls right here on s18e11.
Welcome back to the girls. You're watching an episode with one of our return guests, Dr. James Deom. And Dr. Deom has offices in 3 locations throughout Pennsylvania, right, Doc?
That's right. Yep. Hazleton, Tannersville, and now we are so excited to be in Pottsville, Schuylkill County. Yes.
Well, we're talking about various eye conditions, and a question that I always have is, even people who lose their vision need to get their eyes checked, right?
Yeah, I would say both sides of this coin is important. There's people that, get LASIK, and they're like, well, I have LASIK. I don't need to get my eyes checked anymore. I could see great. I don't need to go. So that's not true, right? That's not true. And we said why that's not true. It's because there's lots of other things that could go on inside your eye. And the opposite is true. Just because you don't have good vision or any vision doesn't mean that we still don't want to evaluate that organ. It's an organ, again, that could tell you about a lot of other things. There is, in some cases, actually a condition. It's called sympathetic ophthalmia, where if you have no vision or very low vision in one eye, that your body can kind of attack that eye, realize something's not going on there, form almost like a immune reaction to that eye and attack your good eye. So, you really want to try and make sure that, if you have one eye that's very poor vision or no vision, and or both, that you're managing that, both for the reason of making sure that organ is healthy, but also to maintain ocular comfort. Oftentimes patients that have very low or no vision deal with things like dry eye and blepharitis or inflammation of the eyelids. And these are things that can bother them just as much as anyone else if they do or do not have vision. So there's lots of reasons why, somebody with no or low vision may want to, or should be getting an eye exam.
And Doc, one thing is, how often should a person get an eye exam? Is it once a year? Or if you have other conditions, of course, I'm sure you're going to have them come back more often. But what is the standard rule for, and what age should you start with eye exams?
Yeah. So I love seeing babies. I'm not sure when this is going to be showing, but we're having a new baby coming into the world probably any second here. So maybe by the time this is showing, we'll have a new baby boy. I love kids, have 3 of them myself. This is something that we do enjoy. So we see 6-month-olds actually as our first time that we see a baby. What do? We make sure that their eyes are responding to light, that they're tracking objects, that we could actually assess whether or not they need glasses. I prescribed several pairs of glasses for very young, for infants that have extremely high prescriptions. It's odd, but it's rare, but it does happen. And then basically from then on, 6 months. And then we typically, if everything's good, we'll see them again at 3. Why? Because they're getting ready for preschool and learning and definitely want to make sure they're hitting some visual milestones. And then again at 5. Okay. As long as everything's good. So 3 and 5, as long as everything's normal, we want to see them at 3 and 5. Why? Because they're entering different, parts of schooling. And then every year from then on, basically, is what we recommend a yearly eye exam from then on.
Doc, how important is it? I know that kids are in school, out of school right now, but I know Lori's organization goes into schools. How important is that? And Lori, maybe you can chime in there, that kids are getting their eyes actually checked in school as well. Is that you guys work together then, Lori? How does that work?
Yeah, so when we do a vision screening, of course, we're not doing a comprehensive exam like Dr. Deom's doing at his office. We're just doing a screening. So we're checking to see how well a child could see by doing what we call, we now use a spot screener, which is looks like a little camera. And that can show me if a child has astigmatism, if they have amblyopia, strabismus. So, a 3-year-old is when we start, and 3-year-olds don't know how well they're supposed to see. So if you think about that as an adult, Janine, you were starting to struggle a little bit to see things. So you knew it was time you needed to go see Dr. Deom, but a child has no idea how well they're supposed to see. So then we do a follow-up. We refer them. Obviously, we hope that they're going out to see Dr. Deom's practice and getting the good care there. And then we follow up to see if they were prescribed glasses or something else.
Yeah, I think whether you know this or not, it's actually state law that you need to get a examination by a dentist, before you go to school. I'm not sure if that's because, you got to make sure that I don't know what part of, dental health has to do with learning, but no offense to my dental colleagues. No offense. I don't want the dentist, throwing stones at me here. That's not what I'm saying.
I don't like to go to the dentist either. So you're all in the same boat.
But listen, this is crazy, right? We need to get we need to get our teeth checked before we go to school, which I think is very important, state law. But there's no state law that says you need to have a good comprehensive eye exam. So, what Lori's doing, the great work that she's doing, making sure that our children can see and process the information that they're needing to do to learn is so unbelievably important. And, really it's taken the horse to water and making them drink, right? Because yes, you can go into the schools. Yes, you can find out if they have trouble, but then of course, there's many barriers, getting the kids to get to us to get the exam is sometimes the trouble. And so I will tell you, I'm very involved, on the legislative front, in the state of Pennsylvania, talking to our legislators every year. We have what's called a lobby day where we go to Harrisburg and, we harass our legislators all throughout the rest of the year on the importance of a comprehensive mandated eye exam prior to entering school. It is not state law, and we currently have a bill in the legislature, the state house, for this to pass, and it's been there. And naturally, believe it or not, there's people that fight us on it. The nurses and other folks, because of different issues with paperwork and stuff like that. But it's a tough issue and definitely an important thing to discuss.
Right. Well, I see you have the eye chart up, and we have to come and have our eyes checked again. We could do our check HDKCR.
Look at that. You're 2100.
I got to that little row.
That's right.
HDKCN. You see those wrinkles forming with me squinting?
That's what I'm saying. Get your glasses.
Glasses are coming in. Can't wait, Lori.
Yes, I can't wait
Dr.
either.
Deom, thank you and congratulations. I'm sure by the time this airs, we'll have a picture of your newbie.
Yes.
Lots of luck with your little man.
Thank
You're
you so
still
much.
little Jimmy. You're
That's
still
right.
little Jimmy.
Always. I'll take it.
Always our little Jimmy. Well, it's always great to see your family growing and your business growing. You have more locations, more opportunities for people to get out to see you. You're a fabulous doctor, along with all of the doctors in your practice. So thanks for taking the time. I know you're busy today, but it's all important to get this information out there.
I appreciate the opportunity. Thank you to all of you.